So Vascular Reserve is a unique result that BlueDop gives you in that BlueDop will assess the mean perfusion pressure and all those great things. But the other thing BlueDop will evaluate is how much of that blood flow is actually going to the tissue. And we do it for simple sake and kind of almost a photo negative in that if the tissues are only consuming about 6% of the blood flow coming in, that means you're going to have a reserve of about 94%. So you've got a lot more capacity to increase that. What's the clinical significance of that? Well, obviously, if you're young, you're healthy, or even if you're older and healthy, you're going to be using little of that blood flow at rest. If we start walking then that reserve is going to drop as that muscle needs more blood flow. That means your reserve is going to drop off. Or if it's a situation where you already have impaired blood flow, so you don't have as much blood flow, so obviously proportionally the tissue is using a bigger portion of that. And that's how we look at that with BlueDop and with BlueDop Vascular Expert. If you have somebody come in with a vascular reserve of, let's say, 20%, that means they're using 80% of that flow. The significance of that is they don't have a lot more to give, okay? And I mean, in the critically ischemic tissue, you can have a negative vascular reserve, which means the tissue wants more blood flow than we're even providing it. And that's when you're going to start having tissue loss, spontaneous tissue loss, and that's limb-threatening ischemia. That's a medical emergency. What I think vascular reserve is helpful with is as you revascularize a patient, you can start seeing their vascular reserve increase. And that gives you confidence that you actually have now enough blood flow to heal tissue.